I'm the medical director of Smart TMS space in the UK. We've been founded for about 6 years, and over the years we've gradually grown to 9 clinics, including Republic of Ireland. And over that period of time, it's been a slow burn, but we've now treated about 650 patients in total. We've started treating OCD 5 years ago, probably a long time before most people have done. And in order to translate the research to the clinic, we follow a certain methodology. So first of all, we're looking for safety. So we're looking at all the research to check that the protocols we're using are safe. We then make sure they're effective by showing consistent improvement with RCTs. And then we're looking for efficiency. We try and treat our patients within 30-minute time slots. This is a review of the research which we've used to formulate our protocols. So it's a fairly comprehensive review of all the OCD research over the years, looking at the various parts of the brain which are treated with various protocols. So, we're looking at the right dorsolateral prefrontal cortex with 1 Hertz, and with CTBS. We're looking at the bilateral supplementary motor area with 1 Hertz. We're looking at the sequential treatment with the right dorsolateral prefrontal cortex and supplementary motor area, and we're looking at the left orbitofrontal cortex of 1 Hertz. From that, we've distilled down 2 protocols, one which is with sequential low frequency treatment over the right dorsolateral prefrontal cortex, followed by the bilateral supplementary motor area, and the other protocol which is low frequency over the left medial orbitofrontal cortex. And we do that by giving the treatment sequentially with 5 sessions each, and we're looking for a response with either approximately a 10% reduction in the Y-box score or subjective improvement. If we don't get any response through the protocol after the 5 sessions, then we consider discharge. In those that do respond, a typical course is up to about 30 sessions or when the response to the treatment plateaus. We give the treatment as a minimum of 3 sessions per week, or accelerated TMS up to 5 sessions a day, separated by a minimum of 20 minutes. We have tried symptom provocation with the methodology published by Kami et al. But we actually found it practically too difficult. Either the patients found it too distressing, or the TMS practitioners found it too distressing. So we dropped that after a period of time where we felt that it didn't add to the overall treatment. This is our clinical audit up to May of this year. Up to that time, we treated 77 patients for OCD. They had a mean score of 37 years. More males than females, a baseline pre-treatment score of 26 out of 40 on the Y-box. They required an average of 17 sessions, and the final mean Y-box score was 19. The remission rate, defined as a Y-box score of less than 14, was 30%, and the response rate, defined as a reduction of symptoms of 30% or more, was 40%. And the overall reduction in Y-box scores from baseline to the final scores was 24%. There's quite a binary response to OCD treatment, and so the results are not terribly well captured on mean scores. And probably the more important scores here are the remission rate and the response rate. We also looked at the 2 protocols, Protocol 1 and Protocol 2, to see how they responded. Of the 77 patients, we screened out 41 patients who didn't respond, 36 did respond, and then we found that 29 of those responded to the Protocol 1 and 7 responded to Protocol 2. And the final mean Y-box scores for the Protocol 1 was 18.4, and the final mean Y-box score for Protocol 2 was 17. And so we found that they can be equally effective, provided you give the right protocol to the right person. We've looked at the side effects of low frequency TMS treatment because there's not a lot of information on that in the literature, and we've compared that in our patients to high frequency, and this was the total number of symptoms, total type of symptoms reported. And headaches with low frequency, we had 8.7%, nausea 4.4%, fatigue 13%, feeling lightheaded 8.7%, and tooth pain in 4.4%. All the frequencies of symptoms were higher with high frequency than with low frequency. And there were no patients with any activation syndrome. This is the case study of one person, just to show how a typical person who is a responder responds. This was a 38-year-old female. She'd had OCD since the age of 17 years. She'd previously partially responded to CBT and high-dose SSRIs. Her white box score at baseline was 35, and PHQ-9 at baseline was 13. She had 25 sessions. Subjectively, there was a marked reduction in her symptoms, and at the end of the treatment, the Y box was 7 and the PHQ-9 was 1. And you can see on the graph the way that reduced over time, and that's a fairly typical response curve in those that do respond, with a very good outcome at the end. We do maintenance treatment for OCD. There's I think there's virtually no information in the literature about this. We do 2 sessions per month, and we've been doing that for several years now. And we've got a number of case studies where we've kept people completely symptom-free for at least 2 years. Sometimes people have a slight relapse, and we're able to treat that with an increase in frequency of treatment. But we've kept people almost completely in remission for the whole 2-year period who have previously suffered with chronic OCD. Just to finish up, I'd just like to note that we do TMS prescriber training. We do free training in the UK, which is to enable psychiatrists or GPs to recommend our TMS treatment to their patients with confidence, because we know that it's not very well. People are not being trained in this presently. And we offer 5 modules of training online, with 1 module of hands-on experience in one of our clinics, and the treatment's completely free. And if anyone's interested in that, they can contact Smart TMS for the details at info@smarttms, and the telephone numbers on the website. Just finally, we get lots of very good patient testimonials. Those patients do respond. It gives a dramatic change in their life. And this is one of those testimonials from a patient who had a very good response. So that's the end of my part of the talk. Thank you very much.